This video explores why broccoli might not be the harmless superfood we've been led to believe. We'll examine 10 concerning issues potentially lurking behind those green florets, from hormone disruptions and digestive irritation to medication interactions, and even body odor problems. You'll hear authentic accounts from American patients, current research findings, and recommendations from U.S. healthcare professionals. If broccoli is part of your daily diet, be sure to watch until the conclusion to protect your health. Problem 1. Broccoli can interfere with thyroid function? Around 12% of Americans experience thyroid issues during their lifetime, with over 60% unaware of their condition, according to the American Thyroid Association. Hypothyroidism, where the gland produces insufficient hormones, is the most prevalent form. This condition manifests as persistent fatigue, weight increase, swelling, and depression. Women above 40 face the highest risk. Research by the National Institute of Environmental Health Sciences in 2023 demonstrated that individuals with iodine deficiency and already compromised thyroid function who regularly consumed raw broccoli showed an 18% decrease in thyroxine levels over a 2-month period. The culprit is goitrogens in broccoli, natural compounds that inhibit the absorption of iodine essential for hormone production. Dr. Christopher Reed, a Montana endocrinologist with 2 decades of experience, shared a case from 2022 about his patient Laura Harris, age 56. Following a plant-based diet, she incorporated up to 150 grams of raw broccoli into her daily smoothie, believing it beneficial for detoxification. After several months, she sought medical attention for weakness, sleep issues, and persistent coldness. Tests revealed significant hypothyroidism. Her condition stabilized after eliminating raw broccoli and introducing iodine supplements. What to do correctly? If your thyroid function is normal, moderate broccoli consumption is safe. Those with reduced thyroid function or suspected iodine deficiency should only consume thermally processed broccoli after boiling or stewing for a minimum of 8 minutes at temperatures exceeding 90 degrees Celsius. 194 degrees Fahrenheit, to neutralize goitrogens. Those with thyroid conditions should consult an endocrinologist before including broccoli in their regular diet. Problem 2. Broccoli causes bloating and gas. According to the National Institute of Diabetes and Digestive and Kidney Diseases, more than 25 million American adults report regular bloating annually. This extends beyond post-meal discomfort for millions with sensitive digestion. It represents a daily struggle affecting mood, sleep, productivity, and self-confidence. These symptoms are particularly prevalent among women between 40 and 60. While causes vary, consumption of foods containing raffinose and insoluble fiber, such as broccoli, ranks among the most common. Despite its superfood reputation, few discuss broccoli's potential to cause heaviness, rumbling, distension, and uncomfortable bloating. Raffinose, a complex carbohydrate, remains undigested in the small intestine before entering the large intestine, where bacteria feed on it. The fermentation process releases substantial quantities of gaseous hydrogen, methane, and carbon dioxide, resulting in unpleasant sensations and potential pain. A 2022 study conducted jointly by Harvard Medical School and Massachusetts General Hospital involved 186 individuals with chronic complaints of bloating and discomfort after eating. Researchers eliminated broccoli and other cruciferous vegetables from their diet for 4 weeks. Consequently, 74% of participants noted significant symptom reduction within the first week. This confirmed that broccoli, while nutritious, can trigger symptoms, especially in those with heightened sensitivity to FODMAP components. Dr. Rachel Sanders, a Chicago gastroenterologist with 15 years of experience, recounts one patient's experience, Jennifer Moore, age 47. Jennifer maintained an active lifestyle, ate nutritiously, and followed a diet rich in greens. She began consuming broccoli daily microwave steamed and added to lunch. After 2 weeks, persistent bloating, heaviness, and rumbling developed. Initially attributing these symptoms to stress, then intestinal function, she eventually consulted Dr. Sanders, who excluded broccoli and prescribed a gentle FODMAP diet. Jennifer's condition improved within days, and after 3 weeks, the unpleasant symptoms disappeared entirely. How to proceed correctly. If you notice heaviness, bloating, or gas following broccoli consumption, particularly if you have irritable bowel syndrometry, eliminating broccoli for 2 weeks. Avoid raw consumption. To preserve beneficial properties, steam broccoli for at least 10 minutes at temperatures above 85 degrees Celsius, 185 degrees Fahrenheit. This partially breaks down raffinose and reduces gas formation. If problems persist, consult a gastroenterologist and get tested for FODMAP product sensitivity. Problem 3. Broccoli can cause digestive disorders. According to the American Gastroenterological Association, over 60 million Americans experience digestive issues at least monthly. Among them, more than 20% report regular symptoms: post-meal heaviness, rumbling, spasms, and abdominal pain. Women between 45 and 60 face these problems most frequently. Many believe they're eating healthfully regularly, consuming broccoli as a symbol of proper nutrition. However, not every digestive system can handle daily exposure to this vegetable, especially in its raw form. The issue lies in the complex carbohydrates and fiber broccoli contains. Digesting these components requires special enzymes produced by the pancreas and small intestine. In people with reduced enzymatic activity, approximately 28% of Americans, according to Cleveland Clinic, this process becomes compromised. Undigested fibers and sugars enter the large intestine, causing fermentation, spasms, pain, and stool irregularities. Some experience alternating constipation and diarrhea. Others feel constant heaviness, as though food has stalled and isn't being processed. A 2021 study by Mayo Clinic's Division of Gastroenterology and Hepatology included 312 patients with chronic digestive complaints. All demonstrated enzyme deficiencies, primarily lipase and amylase. During the experiment, patients eliminated broccoli and other cruciferous vegetables from their diet for 6 weeks. More than 68% reported resolution of heaviness, pain, and normalized bowel movements. Some patients received enzyme supplements, and even after reintroducing boiled broccoli to their diet, symptoms didn't return. Dr. Mark Bauer, an Austin, Texas gastroenterologist with 20 years of practice, describes a patient case: Michael Williams, age 53. Michael complained of regular post-lunch abdominal pain and persistent fullness lasting until evening. As an accountant, his standard office lunch consisted of broccoli and chicken in a container. Testing revealed mild enzyme deficiency and carbohydrate digestion problems. After excluding raw and lightly cooked broccoli and beginning pre-meal enzyme supplementation, his condition normalized within a week. How to proceed correctly. If you experience heaviness, spasms, rumbling, or irregular bowel movements after consuming broccoli, especially raw, this may indicate enzyme deficiency. Begin by temporarily eliminating broccoli for 2 weeks and observe results. When reintroducing the food, consume only well-cooked form stew for at least 15 minutes at temperatures above 90 degrees Celsius, 194 degrees Fahrenheit. Additionally, consider consulting a gastroenterologist about temporary digestive enzyme supplementation, particularly if you're over 50. Problem 4. Broccoli contains substances that interfere with mineral absorption. According to the National Institutes of Health Office of Dietary Supplements, approximately 10 million American adults suffer from iron, calcium, or zinc deficiencies. These micronutrients are vital for bone health, blood formation, immune function, and even mood regulation. These deficiencies occur most commonly in women over 50, vegetarians, and people following plant-based diets. While broccoli seems an excellent animal product alternative, containing calcium, iron, and some zinc, there's a downside. Broccoli contains phytates and oxalates, natural compounds that bind minerals in the intestine, preventing absorption. Simply put, you might consume iron-rich food, but with substantial broccoli present, your body may only receive 20–30% of the potential nutrients. This becomes particularly problematic with anemia, osteopenia, or decreased bone density conditions already requiring mineral support. In a 2022 study conducted by Tufts University Human Nutrition Research Center on Aging, researchers observed 168 women over 60, those consuming large quantities of broccoli and spinach with limited animal protein intake, had 37% lower absorbable iron levels than women with more diverse diets. Many also exhibited early osteopenia, signs decreased bone density, Dr. Julian Barrett, a Seattle dietitian specializing in geriatric nutrition, cites his patient's case Caroline Miller, age 62. Following a strict vegan diet, she proudly identified broccoli as her main source of calcium and iron. However, after 18 months, she developed muscle cramps and severe fatigue, with tests revealing significant iron and magnesium deficiencies. Her condition improved within a month after dietary adjustments, introduction of iron from legume sources, and raw broccoli elimination. How to proceed correctly. If you follow a plant-based diet or have been diagnosed with anemia, osteopenia, or mineral deficiencies, don't rely on broccoli as your primary iron and calcium source. To reduce phytate and oxalate effects, always apply heat treatments to or boil broccoli for 10 to 12 minutes at temperatures above 90 degrees Celsius, 194 degrees Fahrenheit. Additionally, avoid combining broccoli in the same meal with iron-containing foods such as lentils or iron supplements. Maintain at least a 2-hour interval between consumption. Problem 5. Broccoli can be dangerous for kidney diseases. According to National Kidney Foundation statistics, approximately 37 million American adults, nearly 1 in 7 live with chronic kidney disease. Tens of millions more remain unaware that their kidneys function under strain. While early-stage symptoms often go unnoticed, improper nutrition can accelerate complication development. Broccoli requires special consideration in this context. Initially appearing as a healthy vegetable rich in fiber, vitamins, and antioxidants, its composition can work against those with kidney disease. First, broccoli contains substantial potassium, approximately 300 milligrams per 100 grams. Second, it contains oxalates, compounds that can accumulate and contribute to kidney stone formation. Healthy kidneys can manage this, but with reduced function, they struggle to quickly eliminate excess potassium or oxalates. This can cause weakness, arrhythmia, numbness, and even heart rhythm disturbances. In a 2023 University of California, San Francisco Renal Nutrition Center study, 97 people with chronic kidney disease stages 2 and 3 participated. Those consuming broccoli at least 3 times weekly had average potassium levels 18% higher than the group excluding broccoli and other high-potassium foods. 22% of patients experienced kidney symptom exacerbation within 6 weeks. Dr. Jose Mendez, an Arizona nephrologist, recalls a patient, case Jason Richard, age 65. Jason was receiving treatment for hypertension and type 2 diabetes, which had already damaged his kidneys. To cleanse his body, he adopted a plant-based diet centered around broccoli. After 1 month, edema appeared, his blood pressure became unstable, and tests revealed dramatic potassium elevation. After excluding broccoli and transitioning to a renal diet, his indicators normalized within 3 weeks. How to proceed correctly. With kidney disease, even early stage, limit high potassium and high oxalate foods, including broccoli. Consume no more than 50-70 grams daily, necessarily after boiling for at least 15 minutes, at temperatures not below 95 degrees Celsius, 203 degrees Fahrenheit. This helps reduce potassium to safe levels. Always consult a nephrologist for personalized dietary guidance. Problem 6. Broccoli can reduce the effectiveness of certain medications. In the United States, over 131 million people take prescription medications daily, nearly half the adult population, according to the Agency for Healthcare Research and Quality. Particularly common are medications for thyroid conditions, hypertension, diabetes, and blood thinners. Many attempt to eat healthfully and include broccoli in their diet, unaware that this nutritious vegetable might interfere with medication efficacy. Broccoli contains specific substances, glucosinolates and isothiocyanates, which activate liver enzyme systems, particularly the cytochrome P450 enzyme family. These enzymes accelerate the breakdown and elimination of numerous drugs. Consequently, medications may act less effectively or leave the bloodstream too rapidly without achieving the desired effect. This proves especially dangerous when taking thyroid hormones, blood pressure medications, and anticoagulants like warfarin. A 2021 University of North Carolina Eshelman School of Pharmacy study included 118 patients with hypothyroidism and deep vein thrombosis. For 8 weeks, researchers observed a group regularly consuming broccoli, approximately 100 grams daily, and a control group. The first group showed a decrease in levothyroxine's therapeutic effect by an average of 22%, alongside unstable INR indicators in warfarin patients. This confirmed broccoli's potential interference with drug metabolism. Dr. Mary Higgins, a practicing Denver pharmacologist, recalls her patient Trevor Radin, age 59, a former firefighter. Trevor took blood thinners following thromboembolism. He began following a nutrition program high in vegetables, including daily portions of steamed broccoli. After 3 weeks, his test revealed dangerously low INR values. The medication wasn't effective. After discontinuing broccoli and adjusting dosage, his condition stabilized. How to proceed correctly? If taking medications, especially thyroid hormones or anticoagulants, always consult your doctor before regular broccoli consumption. If maintaining the food in your diet, limit quantities to 50-70 grams no more than twice weekly and only after heat treatment, boiling or stewing for at least 10 minutes at temperatures above 90 degrees Celsius, 194 degrees Fahrenheit. Also, take medications at least 3 hours after meals containing broccoli to minimize drug interaction risk. Problem 7. Broccoli increases stomach stress with gastritis and ulcers. Today, over 25 million Americans live with gastritis, erosions, or peptic ulcer disease, according to Cleveland Clinic Center for Functional Medicine data. For most, the condition manifests subtly without sharp pains, but with persistent burning, heartburn, heaviness, and nausea. In such circumstances, even one unsuitable food can dramatically worsen the condition. Unfortunately, broccoli often fits this description. Many gastritis patients strive for proper nutrition and include broccoli as a fiber source, overlooking an important factor. It contains rigid, rough fibers and sulfur-containing compounds that irritate inflamed stomach lining. This increases acidity and gastric juice secretion, which exacerbates inflammation, causes spasms and burning, and may even trigger ulcer recurrence. In a 2022 University of Michigan Digestive Health Center study, 163 chronic gastritis and peptic ulcer disease patients in remission participated. They were instructed to introduce boiled broccoli into their diet. Within 5 to 7 days, 52% developed exacerbation symptoms: heartburn, pulling epigastric pains, and substernal burning sensations. After excluding broccoli, all symptoms resolved without medication. Dr. Jordan Mason, a Sacramento gastroenterologist, shares his patient's story. Linda Norton, age 66. Following ulcer treatment, she adopted a gentle diet featuring broccoli as the main side dish. After 10 days, pain returned. Linda attributed this to stress, but gastroscopy revealed mucosal irritation. After completely eliminating broccoli and substituting stewed carrots and potatoes, her stomach recovered within 2 weeks. How to proceed correctly? With gastritis, elevated acidity, or peptic ulcer disease, completely eliminate raw broccoli. Even stewed broccoli may cause exacerbation. Only reintroduce it during complete remission and in minimal amounts, no more than 50 grams, after prolonged boiling for at least 15 minutes at temperatures above 95 degrees Celsius, 203 degrees Fahrenheit. If any symptoms appear, heartburn, burning, or pain, immediately exclude the vegetable and consult a gastroenterologist. Problem 8. High risk of pesticide load. According to the Environmental Working Group's 2024 annual report, broccoli has joined the list of products frequently containing agrochemical residues even after standard washing. Of 100 samples tested in California laboratories, over 70% contained at least one pesticide trace, and 32% showed 3 or more chemical substances simultaneously. Although acceptable limits weren't exceeded, medical professionals worry that multiple pesticide combinations may pose chronic threats to liver and hormonal system health. Pesticides accumulate gradually. Initially asymptomatic, people, especially those over 50, eventually develop unexplained hormone fluctuations, sleep disturbances, fatigue, decreased immunity, and concentration problems. The liver, as the primary filter, faces the greatest impact from continuous exposure. A 2023 University of California Davis School of Medicine study established a connection between industrially produced broccoli consumption and elevated liver strain markers in patients over 60. In an 8-week experiment, participants consumed 150 grams of supermarket broccoli daily. Blood tests showed 15–20% increases in ALT and alkaline phosphatase levels. After switching to organic broccoli, indicator levels returned to normal within 1 month. Dr. Nancy Hoffman, a Portland endocrinologist, observed a patient in 2022, Ron Williamson, age 61. He transitioned to a clean diet, featuring broccoli as the primary side dish. After 6 weeks, he developed sleep problems, insomnia, morning nausea, and fatigue. Liver enzymes were elevated. Upon learning, he consumed non-organic broccoli daily. Temporary exclusion was recommended. After 2 weeks, indicators normalized, and organic broccoli was reintroduced in moderate amounts. How to proceed correctly? Always verify the source when purchasing broccoli. Prefer organic varieties, especially if consumed frequently. Even organic broccoli requires washing in a solution of water with table vinegar, 1 tablespoon per liter, for 5 minutes, followed by thorough rinsing with clean water. If consuming broccoli daily, limit portions to 100 grams and alternate with other vegetables. Problem 9. Can cause increased sweating and unpleasant body odor. Body odor issues affect millions of Americans. According to a National Institute of Health Behavior and Environment survey, 28% of respondents over 50 notice their body now smells differently than in youth. Many factors may contribute, from hormonal changes to skin microflora. Few connect this issue with their diet. Yet broccoli, like other cruciferous vegetables, can cause increased sweating and strong body odor. Broccoli contains sulfur compounds, particularly sulforaphane and allyl isothiocyanate. After digestion, these break down into substances excreted through skin pores and lungs. Some bodies process this unnoticeably. Others develop persistent, sharp odor, especially with regular raw broccoli consumption or compromised liver function that cannot fully neutralize breakdown products. In 2022, the University of Pennsylvania Department of Dermatology published research examining body odor changes in 74 volunteers who consumed raw broccoli daily for 3 weeks. In 39% of cases, sweat odor changed, particularly in armpit and back areas. For 19%, the smell became so pronounced that it was noticeable on clothing hours after showering. Dr. James Livingston, a Minneapolis dermatologist, cites Jane Carter's case, age 55, who complained that even deodorant had become ineffective. She maintained a healthy lifestyle and attributed the odor to aging. However, detailed dietary analysis revealed she consumed up to 200 grams of broccoli daily. After 2 weeks without this food, the smell disappeared. When the vegetable was reintroduced but only boiled and no more than twice weekly, the odor did not return. How to proceed correctly? If you notice body odor changes after adopting healthy eating, try temporarily eliminating broccoli, especially raw forms. This typically resolves the situation. To reduce sulfur-containing compound concentration, boil broccoli for 10 minutes at temperatures above 90 degrees Celsius, 194 degrees Fahrenheit, and limit quantities to 50–100 grams per meal. Problem 10. Can exacerbate small intestinal bacterial overgrowth, SIBO. Currently, small intestinal bacterial overgrowth SIBO affects over 12 million Americans. However, according to the American College of Gastroenterology, actual sufferer numbers are 2 to 3 times higher, as many treat symptoms without identifying the true cause. Primary complaints include bloating, spasms, diarrhea, rumbling, and feeling full even after light meals. SIBO occurs when bacteria normally residing in the large intestine accumulate in the small intestine. They actively process food, especially fiber and complex carbohydrates, producing substantial gas. Unfortunately, broccoli appears on the avoid list with this diagnosis. Rich in insoluble fiber and raffinose, fermentable carbohydrate that fuels bacterial fermentation, even small broccoli quantities can trigger sharp symptom exacerbation in SIBO patients. A 2023 Cedars-Sinai Medical Center, Los Angeles, study included 82 confirmed SIBO patients. After introducing broccoli, just 80 grams daily, symptoms intensified within 3 days for 58%. After excluding the food and adopting a FODMAP diet, improvement appeared within 1 week. Dr. Juliana Wright from Houston observed a patient, Peter Romano, age 48, whose symptoms began 2 months after switching to an anti-carcinogenic diet rich in broccoli, cabbage, and garlic. He experienced nighttime bloating, spasms, and stool irregularities. A breath test confirmed SIBO. After completely eliminating broccoli, symptoms began subsiding within 5 days. His diet was restructured, and only after 2 months was broccoli reintroduced in small amounts, only stewed, and no more than once weekly. How to proceed correctly. With diagnosed or suspected SIBO, completely eliminate broccoli for at least 4 weeks. During this period, follow a low FODMAP diet, excluding all cruciferous vegetables. Only after symptoms disappear can you attempt reintroducing broccoli, boiled no more than 30-50 grams per serving, and no more than once weekly. With the slightest deterioration, exclude it again. Thanks to everyone who subscribed to the channel and put a like. If you have anything to say or have any questions, write a comment.